Hi, my name is Ross Hauser. I'm a medical doctor that specializes in physical medicine and rehabilitation. For the past 20 years, I've done prolotherapy. One of the most common conditions that I see in the office is C1c2 instability. It's also called Atlantoaxial instability or Atlantoaxial subluxations. Upper cervical instability is extremely common and can cause such conditions as post-whiplash syndrome, Borreliose syndrome, post-concussion syndrome, which are responsible for such symptoms as drop attacks, vertigo, tinnitus, ringing in the ears, fullness in the ears, facial pain, shoulder pain, neck pain. It's an extremely common cause of severe migraine headaches or suboccipital pain. So if you suffer from any of these things, I believe you're going to find this animation really fascinating because it's going to show you how C1, C2 instability can cause the pinching of the vertebral artery. It can cause irritation of various other nerves, including the autonomic nerves or the C2 nerve. On the animation, you will see how prolotherapy to the capsular ligaments, by tightening the capsular ligaments of C1, C2, can cause those areas now to be stable. So the motion of those vertebrae will now get back to normal. And hopefully then the person will have resolution of the symptoms. C1, C2 instability is also called Atlantoaxial instability. It's one of the most underdiagnosed conditions. When there's instability of the upper cervical spine, you can get a myriad of symptoms as listed here. The most common symptoms that people experience are migraine headaches, severe neck pain, dizziness, ringing in the ears, and vertigo. The normal anatomy of the upper cervical involves the C1 vertebrae called the atlas and the C2 vertebrae called the axis. When the person turns their head, these are supposed to stay in alignment. This can only occur if the capsular ligaments or the facet joints hold the vertebrae in place. When the vertebrae move together, the vertebral artery is fine, the circulation's good, and as well as all the nerves in the upper neck. When the capsular ligaments are injured, as illustrated here, you can see that C1 moves excessively when the head's rotated in relationship to C2. This causes a pinching of the vertebral artery, therefore cutting off blood supply to various parts of the brain, causing a lot of the symptoms of C1, C2 instability. Fortunately, prolotherapy to the C1, C2 area can stimulate healing of the capsular ligaments, causing vertebral motion to be normal and the relieving of all the symptoms of upper cervical instability. If this video applies to you or somebody that you know, feel free to contact us through our website and give us more information about your condition, and we'll let you know whether or not we feel prolotherapy is appropriate for you.